For this type of lancet, see, this is a bit different and much more technical, and this also is a little bit much more technical. So it's not hard. It can be very tricky. Some persons have failed OSCE just because they don't know how to open or make use of lancet. All right, good day to you wherever you are hearing my voice. Welcome to ENGS OSCE channel, where we make OSCE easy for you. My name is Otaide, and I'm going to be your anchor assessor. Okay, so I'm going to be welcoming the nurse that is going to be taking this procedure. We are going to be taking this scenario that has to do with blood sugar monitoring. Yes, blood sugar monitoring. You might have seen it done elsewhere before, but trust me, you are going to learn a thing or two in the course of this video. So watch along with us. If there is anything that strikes your attention, jot it down. We'll try our best to provide you further tips at the end of this video. Now, with that being said, I'm going to call in the nurse now, while I will act as the assessor and also responding when the question comes for the patient. All right, are you ready? You can come in now. Okay. All right, you are welcome. Are you comfortable? Are you fit and well?
Yeah.
Obviously, your assessor doesn't need to talk so much. He's just going to tell you that every equipment you need for a procedure are available for you. All these preamble talk are just to guide you through this procedure and ensure that you can be well carried along. Mind you, whatsoever we show you here is not a replacement of our classic online lectures and then the physical assessment, which is available to you both right here in UK and also in Lagos, Nigeria. So don't worry, we want to hold you by your hand. Just walk along with us and then see how we do carry out this scenario so that you can learn it. So are you comfortable?
Sure.
Okay. So all your equipment have been made available to you. Can you confirm you are fit and well to start?
Sure.
All right. So your time starts now.
Go through my scenario. Since for safety, I see that nothing's closer to me on my patient, and I'm going to approach the scene. I'm going to close the door and draw the curtains to provide privacy and dignity for my patient, and I'm going to apply an ample amount of gel and perform hygiene following the WHO standard. Rubbing palm to palm. Right palm over the horizontal and raise yourself, fingers interlace, fingers interlock and raise yourself, shadowing on the palm and raise yourself, fingertips strength on raise yourself, shadowing on the wrist. Raise yourself, I'm going to allow my hands to enjoy for 10 seconds and my hands are clean. Alright, so hi.
Hello.
My name is Nosata and I'm here to check your blood glucose level this morning. Are you expecting me?
Yes.
Alright, can you tell me your full name and your date of birth while I cross check my documents and your wristband?
Alright, Jennifer Garnett, 15th of 8th, 2000.
Alright, I have here with me Jennifer Garnett and date of birth is 15/8/2000. Hospital number is NHS 12345. I can confirm that with the right patient. What would you like me to call you, Jennifer Garnett?
You can call me Jenny.
Jenny, alright, that's fine, Jenny. Have you got any allergies, Jenny?
No allergy.
No allergies. Are you in pain currently?
No pain.
No pain. On a scale of 0 to 10, you confirm it's a score of 0?
0.
Thank you very much. So in the meantime, I'll just go and get my equipment. If you need anything, you can use the cover. I'm going to be right back. Fine.
That's fine.
Thank you. So I'm going to perform hygiene again. Assessor, am I using a disposable or usable tray?
Disposable.
Disposable tray. Okay, I can see that it's clean and is intact. I'm happy to use.
Thank you, Lord.
Thank you. So I have here with me a glucose strip. I see that it's clean and is intact. Expiring date is on the 24/12/2028 and I'm happy to use. Assessor, can you confirm this has been stored in an airtight container?
Yes, according to manufacturer guideline.
Okay, that's fine. I have here with me the glucometer. I can see that it's clean. Assessor, can you confirm if it's clean and calibrated with last 24 hours ready for use?
Yes.
Alright, so I'm going to just on it to be sure it's working.
Thank you.
I have the date and time showing. I can confirm that it's working. I'm happy to use this.
Thank you, Lord.
I have here with me the cleaner wipe. I can see that it's clean and it's intact, not broken. The expiring date is on the 14/6/2026 and I'm happy to use this.
Thank you, Lord.
Alright, thank you. Here with me the gloves. I can see that it's clean and it's intact. Expiring date is 2028. I'm happy to use.
Thank you, Lord.
I have here the lancet. I can see that it's clean and it's intact. Expiring date is on the 13/9/2028, and I'm happy to use. I'll just pick one of it. I can see that it's not broken and it's a single use, dry, and I'm happy to use this. I'll just keep this below. I have here with me the sharp box, and I can confirm that it is 1/3 filled, and I'm happy to use it. So I have my gloves and apron below. I'm going to be using to actually perform the procedure. So I'm going to perform hygiene and go back to my patient. Palm to palm. Alright, Jenny, I am back to actually perform the procedure. Is that fine?
Yeah.
Would you like me to proceed?
Of course.
Alright, I'm here to actually, like I said, check your blood glucose and to take your post-meal blood glucose level, alright?
Yeah.
Alright, so can you confirm, have you eaten anything?
Yeah, I took some food earlier.
Okay, how long was that?
About 4 hours ago now.
4 hours ago.
Yeah.
Alright, if that's supposed to know, then I'm not concerned about that, okay?
Alright.
So I'll just go ahead and wear my gloves and apron.
Okay.
Perform hygiene again, following WHO standard. Alright, Jenny, I'm going to be using your finger for this procedure.
Okay.
I'm going to avoid using the thumb and the index finger because these are frequently used, alright?
Okay.
And then I'm going to be using either of the three. Which would you like me to use, Jenny?
You can use either, it's okay, anyone you choose.
Alright.
Take a pick.
Alright then. I'm going to assess your finger. I can see that there is no death, there is no rash, no swelling, no redness, no inflammation, and I'm happy to use. I'm going to use the middle one. Is that fine?
That's
I'm
fine.
going to avoid pricking the surface, and I'm going to be pricking the side of it because to reduce the pain. Is that fine?
Oh, thank you.
Alright, thank you. So had it been it's dirty, I'm going to use the chlorhexidine to actually clean for 30 seconds. I like to dry for 30 seconds before going ahead. But I can see that it's clean and I'm happy to proceed, alright?
That's fine.
Thank you. So before pricking, would you like to sit down or lie down? Because some people have phobia for blood.
No, I'm okay, I'm comfortable.
You're comfortable lying down?
Yeah.
Right? Okay, then that's fine. So I'm going to just pick a strip. I'm going to insert it. Insert the machine. Okay. So I'm going to pick the middle finger.
Okay.
I'm going to open this. I'll discard this inside the clinical USB. I'm going to prick the middle finger. I can see that it's clean and I'm going to be pricking the side of it. I'm going to discard this immediately inside the sharp box.
Oh.
And I'm going to take the reading. Now I'm not going to press the hand. I'm going to allow the blood to come out fully to cover the entire screen of the strip. Is that okay?
Yeah.
Alright. So sorry Jenny, here is a gauze. You can use this to prevent bleeding. Is that fine?
That's fine.
So sorry. Alright, so I'm going to check the reading. Alright, you have a reading of 5.7, Jenny. I'm going to remove this and discard inside the clinical waste immediately. And I'm going to remove my gloves and apron. I'm discard inside the clinical waste bin. I'm going to perform hygiene for the WHO standard. Quickly, I'm going to document my reading. Alright, Jenny, thank you so much for your time, alright?
Thank you.
I'm done checking your post meal and it's a 5.7 like I said, but it's a little bit normal since you actually ate 4 hours back, right? So it's not a big deal. The normal pre-meal for diabetic patients is 4 to 7 and the post meal is 5 to 9, alright?
Okay.
So I'm not concerned, though it's a little bit low, though I'm going to come and keep checking to ensure that you are fine. Is that fine?
Yeah.
Alright, then have you got anything to eat, like maybe snacks or drinks or something?
Yeah, I have everything with me, so you have nothing to bother about.
Alright, then that's fine. Some of the possible side effects of hypoglycemia you might happen to see the signs is maybe you might be sweating, you might feel dizzy, or if you have any of those symptoms, you can just give me a call back and I'm going to be back. Is that fine?
That's fine.
Thank you, and in case of emergency, you can call me.
Alright.
So thank you.
Thank you,
I'm going
nurse.
to clean my equipment and make it ready for the next use. I'm going to take my strip and put it in an airtight container and seal it for the next use. And I'm going to end my section with hand hygiene. Following the way to standard, rubbing palm to palm. Right palm over the other side and vice versa. Fingers into this, fingers into the mouth and vice versa. Shan over the palm, vice versa. Fingertips to the rub and vice versa. Shan over the wrist. Vice versa, I'm going to allow my hands to dry for 10 seconds and my hands are clean.
Alright, thank you. Thank you. Alright, I hope you learned a thing or two because of this assessment session of checking the blood sugar. And we hope you will be able to benefit from this quick scenario that we just displayed to you. Now, leaving that aside, there are a few things I need to just bring to your attention. Number one, observe that he read this scenario. You've seen quite a lot of our video where we have to do it in the community, and you can see this was a hospital scenario. The best way to know whether it's going to be hospital-based scenario or community-based is read your scenario. So when you read your scenario, you know how to approach your station and how to ask the relevant question. Now, you could also observe in the course of this section that there were different lancets. So let me bring this down a bit. Quite a lot of lancets are in here. In your center, you may have different types of lancets. So we've already kept so many types of lancets here, and this is another one. So I will move a little bit closer so you can see this is one type of lancet, this is another type of lancet, this is another type of lancet, and then some of you might already be used to this type of lancet. You will hardly see this in your OSCE center. So this, you don't see this, you know this, you don't see this, and you don't need to recap or resheet or anything. So whenever you open a lancet and you have used it, you kindly what? You discard. So we discard that into the sharp box. So that's that for this. Now for this type of lancet, see, this is a bit different and much more technical, and this also is a little bit much more technical. So it's not hard, it can be very tricky. Some persons have failed OSCE just because they don't know how to open or make use of lancet. So continuing for the various types of lancets, I've showed you this type where you can have an open lancet and you just have to click, which will not come out in your OSCE. You could see this is a more advanced version. You just need to screw this off, and then when you are ready, you click this against the patient's arm. Obviously, you are not going to be choosing these two because it's the most frequently used and the patient usually use them a lot. So you are choosing this, and you will be pricking at the side because here you have lesser pain receptors. So please take note of that. And then this is also an advanced form of lancet. That's why we recommend you come for physical assessment, so that all these things you'll be able to practice with them. We don't want to hear that, oh, because you don't know how to press lancets the right way, that was why somebody have issue in his or her OSCE. So please, let's do it right, and let's smash it together. Now, also observe that when he was talking about the sharp bus, this is small version of the sharp bus. You can see 1, 2, 3, 4. These are various graduation, various stages. So when you say it should be less than 3/4 full, you are literally saying that nothing should be above this zone. But from here down, things can be there, so that somebody will not end up pricking his or her finger, just to prevent needle prick injury. So that's basically it on that. Again, sometimes in your center, you may have a bleeding mannequin, like in the case here where he pricked and then he was able to get reading. But other times, you may not have a mannequin that bleeds. In that case, the assessor is going to provide you with something that looks more like blood, but it's not really blood, but that is going to bleed. And then you can be able to take the reading and say what it is. So if this video has been useful to you so far and you have learned something new, try to subscribe to the channel and give it a like, give this video a thumbs up. It will go a long way to being much more helpful to you in the future. Now, we, as part of our addition to this video, we've added past question link just look at the description of this video. You will see a Telegram group. You can join that group and you'll be able to have access to media of NHS and UK, US, Canada, past question that you can play along with. You just need to set the name of the trust and then boom, here you have it. We want to support you as much as possible to ensure that you are able to smash it when it comes to your next upcoming OSCE exam. Now, if you don't document anything, it's assumed that it's not done. So please, when you finish your scenario, always document your reading. Mind you, there's a difference between pre-meal and post-meal. Sometimes your question may outrightly state this. They'll say, go and check post-meal for your patient or go and check pre-meal for your patient. Always ask your patient, have you eaten? If the patient says they have eaten, you ask how long ago. Mind you, if the patient has eaten just 1 hour ago, that cannot count as post-meal because it's just 1 hour ago and it's assumed that it will take time before this food will start getting to the patient's system to start working. So obviously that will still count as what pre-meal. However, if the patient has eaten like 4 hours ago, 5 hours ago, that is obviously going to be a post-meal. And if for any reason you were originally told to go and check post-meal and then you now discover that patient have not eaten at all and it's going to be counting as pre-meal, when you take your reading, you are going to document it under pre-meal and then you let the assessor know that because the patient have not eaten, you have just taken the patient pre-meal, but you are still going to come around to check for his post-meal after certain hours, but you will provide him food to eat now. So you see, by so doing, your rationale will have saved you. So please take note of that. Now, as we are much more details with all these things, this is just the tips of the iPad. We want to ensure that you succeed on this journey, and our class is so unique that no matter how busy your schedule is, we hold you by your hand and ensure that you are ready to smash it. Mind you, you are going to be dealing with a real life patient after your OSCE. So we are not just preparing you to pass an exam. We want to ensure that you have all the necessary skills that you need to be able to do it right and get it right once and for all. Smash it in one sitting. God's will. Now, leaving that aside, you already know by now that ENGS have physical assessment center available to you both in UK and in Nigeria. We can't wait to have you come around and practice until you are ready. Accommodation will also be available. You'll be able to practice night and day, 247, with all interlight and all the necessary things that you need. Just come along with your food and valuables, and then you will be able to practice, go for your exam and smash it. Our center is strategically located also to be close to all the various OSCE centers, which actually helps you have options to whichever way, wherever you go, you are well determined and you know that you can easily get yourself to your center and then smash it. Thank you so much, and I believe that you have known that there are different types of lancets that you can find in your OSCE. It's not just one type, and then most of the common lancets you can find are usually in the form of these three, which I have shown you before, and I also try to show you how to open them up. And again, in case you don't know, you take this off. You don't just pull it, because if you pull it, you've already spoiled it. If you pull it, you spoiled it. That means the assessor is going to assume you don't know how to use your equipment, so you don't want that to be your case. So you screw until it comes out. Then you can be able to prick the patient with it. And then this is similar. You screw until it comes out, and then you'll be able to prick the patient with it. So please make sure you use these things. Make sure you practice with them. Make sure you come for your physical assessment center. I don't want to hear that it's just to use lancet. That is why somebody have a feel. So please, we don't want that. We wish you success in your OSCE journey, and then we want to see you as the next UK one. Success are with you. ENGS is signing out. That way he say, bless you in your next upcoming exam. Bye for now.